Grief feels like nothing matters. If you have experienced intense grief, I know that you have said those things to yourself. You've said things like, I don't care. Nothing matters. I want you to take a moment to think how those words and those thoughts are manifesting in your life. There is a choice opportunity in the descriptions that talks about managing expectations of grief. I want you to download that and just use it as a reference here. I have lost 3 children over the course of 17 years, and I am learning and teaching actually how do we grieve and how do we manage the expectations of how much time and energy that takes. I love to fix things. I love to accomplish things. And I wish I could, go through a 6-week course, a 1-year course, and feel like my grief is healed. But it takes time, and we have to learn to manage those expectations. Shortly after my son Reggie passed away in 2016, this kind of nothing matters, I don't care, manifested very differently than when my daughter passed. When Reggie passed, it was 10 plus years of fighting for his life. And the responsibility of caring for him was a 24-hour responsibility. And so when he passed in 2016, that kind of nothing matters, I don't care, manifested in like at-risk behavior. I refused to wear my seatbelt. I wouldn't wear a helmet on a motorcycle. I was doing stupid stuff. I was impulsive. I wasn't worried about my own life and I was acting immature in some ways. But that's how it was manifesting, and I have to acknowledge that. But I also had to keep it together for my daughter. And I've always been a driven person. I started Mentally Strong at that time, and I knew I had to figure out how to grieve. And like I said, we had fought for Reggie's life for many years, and so there is no part of me that would bring my son back because he was suffering so much. And so there wasn't like this huge spiritual conflict. But my daughter died in her sleep in 2021. Having never been in the ICU, never really spent the night in the hospital for a sickness or a, part of her disease process. Her seizures were well controlled. She was happy. And so when she passed, honestly, the first 8-9 months I was in shock, and I was still in that fight or flight mode and just pushing through. And then if you've been following me, I like consciously stopped and spent 45 days of just active grieving. And it brought a lot of things to the surface. And deep depression, almost suicidal. And I would never hurt myself, but I understand what that feels like. And it manifested, so, when I talked about in the beginning, like grief feels like nothing matters. I've lost both of my biological children. I have no lineage to continue. And when I allowed the intensity of the grief of both children to really come upon me, I experienced all these things that you see in this worksheet. Fatigue, panic attacks, waking in the middle of the night, difficulty sleeping, stomach issues, insomnia, physical pain, not just the emotional pain, but physical pain. All of these things came crushing down. And oftentimes, we don't know what to do with that. And it just all gets enmeshed together. And if you follow me, I have lots of other videos on different things you can do and how to use the mentally strong method to kind of organize those things. But grief hurts. And so the 3 things that I have for you today is you have to give yourself grace. We talk about managing our expectations. What does that mean? That means that grief is pain, and you have to feel that pain, and you have to let that process and move out of your body. And you have to give yourself grace in that whole process. My next tip is super practical. You must make sleep a priority. So often, I see people getting, on sleep medication, which is not bad, but the process is more about trying to get some natural sleep, some healing sleep. I see people turning to alcohol to get to sleep or to numb the pain. The more you numb the pain, you're just prolonging the process. You're not taking away the pain. And so making sleep a priority. There's some times that I allot 12 hours because I need to be trying to sleep for 12 hours to get 6. That includes good sleep hygiene, getting to bed, turning off electronics, not watching shows or being on social media. But I know sometimes when you lay there in the dark, your mind just starts racing, and it's really hard to go to sleep. But we must make sleep a priority. So 1, have grace for yourself. 2, make sleep a priority. And 3 is to feed your mind, your body, and your soul. So when I say feed your mind, this means taking care of yourself, learning to grieve, figuring out how to process that grief, but also how to not talk negatively to yourself, right? Feed your mind positive things. Feed your body. Try not to eat junk food. This is not a time to go on a diet, but it is a time to think about positively feeding your physical body and your soul. Grief brings up spiritual conflict, regardless of what your belief system is. Even if you have no belief system, if you believe there's no God, where is this person who has left this physical earth? That is a spiritual conflict. And I challenge you to work through that, to feed your soul. So in managing the expectations of grief, at least a year for normal grief. Losing a child is not normal grief. Losing a spouse is not normal grief. You know, what is normal grief? I mean, it is a subjective topic, but, you know, someone who, you know, losing your grandmother at old age, or we all will have loss. But when it is outside of the natural process, like losing a child, a year is barely scratching the surface of that grief. I remember when it was about the 5-year mark after Reggie's death that I began to feel confident in how I was processing his grief. And now I will always miss my children. But I would say in losing a child, you've got to give yourself at least 5 years of actively grieving to feel as though you have some control of it, for lack of a better word. And as you're learning to take care of yourself, I want you to kind of follow me on my journey as I'm doing this. And you could start with what I call the 5 selves. And that's how you learn to take care of yourself. And this will automatically go into that, and keep watching. It has, first is kind of the overview of the 5 selves, and then it goes into depth on how do you actually take care of yourself. My name's Christy Bundakumar. I'm a psychiatric nurse practitioner with over 20 years of clinical experience, and I am teaching you and others to grieve.